She's going to walk through this for you, all right? This is what you're going to have to do.
I have to be honest, I didn't get a chance to watch the video.
I don't care.
Okay.
I'm going to go through this with you. Don't you worry. Wow, she's brave, huh? Don't you ever try that with another faculty person. It is screwy. It is hard to see in the back. I tell you, I sat up there where that young lady is for the other meeting because I want to get the hell out of here. And the reality is I couldn't see squat. I don't like this room. I'm not happy, but nobody cares whatever. Right. Please get this bag out of here. You got lactated ringers. Good. Good job. Now, she's checking this bag for expiration date, right? This container may get some sweat in it. That happens sometimes. I don't understand why. It's physics. I know it's physics. Okay. Good. Are you good? Good. All right. Now, hold this bag up like this. Ask them, which port does the IV spike go into?
Which port?
Blue. Blue. Okay. Good job, guys. That's how you do this. All right. Which one is this? That's the main line. That's the piggyback. The piggyback line will always have the blue thing in it. That's the little coat hanger right here. All right? The bag will always have the little blue thing in it. That's one giveaway. Bless you. Everything is always labeled. It says secondary administration. I don't want to tell you it's idiot proof. All right? I don't want you to feel bad. Look for the blue thing, and remember, it's always labeled. All right. So this is your main one. I'll hold your bag. Leave me hold the bag. Open your tubing, Nim. God, she's good, huh? Now, I'm not going to get in a rash because she's opening it all kinds of different ways. I know this is going to change. She's going to get better at this. Besides, you're going to have poison ivy only so many times in a year. All right, now, pull that off. Unwrapping it. It's nice and pristine. You shouldn't use words like virgin because then people get all upset. All right, now, I want you to close the flow clamp. All right, what's the flow clamp? That blue thing. That blue dangling participle. And then this one right here. Close the main one. And turn around and show those guys. Because it's really tough to teach back here. All right, it's closed like that. Oh, that's closing the full clamp. Show them how
Okay.
big it is. All right.
So from here
So there. It's good?
closed.
Okay. I had her close that first because once she spikes this bag, open is up. Yep. Yep. Oh, no. I tell you a little secret when you're teaching. Okay. You have it like this and you say it's closed. All right. If you invert it and then open it, it gets people mixed up because of the imagery. So you keep it like that. I'm teaching her how to do my job. I'm old. All right. Now I still have A-track. All right. And then you pull it up like that.
Okay.
And it's open. See? And
then pull down as well.
Got it. Okay.
All right. Good? All right. She's doing really good, huh? I had to get that 45 cents and that 90 cents. All right. Now she's going to do something called spiking the bag. It is not a party trick. Okay? She is going to put that plastic thing in here, and she has to do it without breaking sterile technique. They are very sharp. If you slip, you will hurt yourself. Okay? They are really sharp, just so you know. Okay, it's on your own.
Okay.
What do you want me? You want me to hold the bag? I trust you. I'll hold it for you. All right.
I don't really know.
You're doing fine. Pull the blue tip off. I won't let you hold it. Okay. Pull the blue tip off of this bag, hon.
Oh.
All right. Pull hard. There we go. Finally. May I have that? Thank you. Okay. Now, pull the plastic thing off of the spike. Give me the plastic. Do not touch the spike. Now you're going to have to put that in here.
Any certain way?
It usually needs a twisting motion.
Oh, okay.
So whenever you need to hold it, let me know. Stop shaking and do not stab the faculty. I have little plastic more. Yes, ma'am. I want you to grab it where I'm holding it and then see if you can twist that puppy in this. That way she will not hurt me.
I think that's good.
That's good. She got it. Invert it. No, you don't need gloves unless it's chemo. And we won't have you administering chemo. Because you wear gloves with chemo, because you absorb the chemo yourself. If you do not have gloves on, ask Professor O'Shea. She and I have already had our chemo. Because years ago, we used to have to mix it on the floor, unhooded. We didn't know it was supposed to be hooded. This was before, you know, you have laws now to protect you from touching hazardous things. We're so damn old, they didn't have those laws back then. And we worked with chemo, we inhaled it, we touched it, we've had our chemo. a long time ago. Now it's mixed under a hood and you wear gloves, you don't have to worry. It wasn't anyone's fault, nobody knew better. That's how it was, okay? I also ride my bike without my helmet. Put this up there, will you?
Okay, so this one?
Yep.
All right.
When you're doing this, don't let the tubing touch the floor, because whether it's a return demonstration and you're stressing, or you're standing near a patient, patient's gonna think very ill of you if this tubing is all hanging on the floor. They're gonna think you're sloppy, and it looks sloppy, all right? How are you doing?
Good. I
All
had
right,
it
good.
backwards.
So, okay, now, I want you to fill the drip chamber up. When we say that, we don't mean fill it, half full. Those of you that have a vision capability will be able to note that there's a minute line halfway in this chamber. Please fill that, you just squeeze it. Just squeeze it, go ahead. Okay? Don't be afraid.
Like, should it be a constant squeeze or
Squeeze,
just?
let go, squeeze,
Okay.
let go. This is
Okay.
your relaxation time.
There we go.
There you go, okay. Now she's gonna do something called priming the tubing. The faculty are all gonna be divided on how to do this the right way. So you are screwed when you go to do this, all right? Because there's always a little bit of air right here in this thing, all right? There is a way of getting it out of there. It's a little tricky. Some faculty are gonna tell you, just pop that off and just use a cup. I'm gonna have her do it without using any other equipment at all, because I do it. I'm not wrong, and they're not more right, and they're not wrong, and I'm not more right. It's just what we know, okay? All right. Once you take this flow clamp, I'm gonna help you here. I'm gonna get this other clamp. This is just a clamp. I'm gonna push it up here and clamp it off, because if she opens up anything right now, it's just gonna come thundering, right? Take your flow clamp here and open it up. Push it way up here where this is. Go ahead, roll it right in. Go ahead. There you go. All right, now, shut it off, please, yep. The reason I'm doing this is because if the flow clamp's way down here, you're gonna be like this, okay? And it's very good if you're in yoga, but this is nursing. All right. Now, very slowly, this is the hard part, I'll open this up now. Very slowly, I want you to open that flow clamp
Okay.
and invert this upside down here.
While I'm doing it?
Yeah, open the flow clamp up a little.
Okay.
A little bit. See it
Little
starting to
one?
drip? Yep.
Oh,
Now
yeah.
invert this. Quick. Invert. Upside down.
Oh.
Inversion. Okay. Maybe I didn't say it right. All right. It's going to get to this part. Don't worry. It's going to catch the air bubble. You can take as long as you need to take for this valve.